last video, I had discussed one very prominent reason of back pain, that was poor nutrition, and there had specially discussed about one vitamin which is very essential to our skeletal health, that is vitamin D. In this video, I will be discussing vitamin D in a little detail and specially focusing on its synthesis via a very natural source, that is sun. Vitamin D deficiency is prevalent not just in India but throughout the world, in sunshine sufficient countries, in sunshine deficient countries. This nutritional deficiency is one of the most underdiagnosed and undertreated nutritional deficiencies. Vitamin D is needed for the maintenance of normal blood levels of calcium and phosphate that are required for normal mineralization of bone, muscle contraction, nerve conduction, and general cellular function. This deficiency has many consequences, like in children, it causes rickets due to defective mineralization of bone. In adults, osteoporosis and osteomalacia, muscle weakness and bone pain, depression, anxiety, low feeling, tendency to catch infections, low immunity, risk of heart diseases, type 2 diabetes, insulin resistance and decreased insulin production, obesity, that is weight gain, and risk of certain cancers. Our Indian diet fails to satisfy the daily requirement of vitamin D for a normal adult. The food are lacking in a good quantity of vitamin D. Vitamin D is present in few fishes like salmon, sardine, tuna, in egg yolks, in cod liver oil, but in vegetables and grains, they lack in vitamin D. So it becomes quite essential to think about fortifying the foods with vitamin D, or taking vitamin D supplements, or taking vitamin D directly from the sun. Vitamin D in general refers to vitamin D3, the active form. This vitamin is made from cholesterol in our skin when it is exposed to sun due to ultraviolet B rays. Synthesis of vitamin D depends on multiple factors like latitude. People living in areas farther away from the equator make less vitamin D in their skin because most of the sun's rays are absorbed by the Earth's ozone layer. Age. As we age, our ability to make vitamin D is reduced by 75%. Body fat. Vitamin D can get trapped in body fat, leading to 55% reduction in blood levels for those who are over fat. Exposure time. Midday is the best time to get sunlight, time ranging between 15 minutes to 30 minutes. Melanin pigmentation. Melanin is the natural sunscreen which protects the skin from excess sunlight. Darker skins have more melanin, that is why they have to spend a little while extra under the sun, time ranging between 30 minutes to 3 hours. Exposure area. More the area of the skin is exposed, more will be the vitamin D synthesis. Use of sunscreens absorbs or reflects ultraviolet B rays and prevents it from reaching the skin. If you think you're soaking a vitamin D through office or car windows, wrong. Glass blocks virtually all UVB. Synthesis of vitamin D via sun has many complications like sunburn is the most common harmful effect of too much sunlight, causing redness, swelling, pain, or blisters. Long-term exposure to UV light can damage the retina, increasing the risk of cataracts. Spending too long in the sun can cause freckles, moles, or make your skin to age faster. Some people develop more wrinkled, loose, or leathery skin. Heat stroke or sunstroke is another complication. Too much UV light is a major cause of skin cancers. Vitamin D toxicity. This overdose of vitamin D usually happens when we are supplementing vitamin D in a pill form. But when we are exposing ourselves to the sun rays for vitamin D synthesis, this complication does not happen. So do not worry about it. So my healthy advice in the end is sunlight is the most natural way of getting vitamin D. Aim for 10 to 30 minutes of midday exposure several times in a week. Darker colored people might have to spend a little extra time under the sun. If your skin is sensitive, be careful, do not get a skin burn. Intense and overexposure to sunlight have a risk of skin cancers. You can apply sunscreen, but it is advisable to have 10 to 30 minutes of unprotected exposure first. If you are on a beach, bathing, sweating continuously, you can apply sunscreen every 2 to 3 hours. Still not able to get enough sunlight? Discuss with your doctor about vitamin D supplementation or foods rich in vitamin D. So, get out of your offices, get out of your homes, take a sweet little dose of free vitamin D. Stay healthy, stay fit.